Welcome to today's video on the early warning signs of heart failure. What if I told you your body might already be sounding the alarm? Signals that could literally save your life if you pay attention. Yet, most people dismiss them as just aging, stress, or being out of shape. Here's the reality. More than 6 million Americans are living with heart failure. Sadly, most don't realize it until the condition has already progressed. That's why today we're uncovering 13 early signs of heart failure that most people overlook. Some of these will surprise you, like why you suddenly need more pillows at night, or why tying your shoes leaves you breathless. Important note, this video is for educational purposes only. It is not medical advice. If you notice these symptoms, consult your healthcare provider. Now, let's dive into the first warning sign. Sign number 1, shortness of breath with simple activity. If walking to the mailbox, climbing one flight of stairs, or doing light chores leaves you struggling to breathe, this is more than being out of shape. When your heart can't pump efficiently, your lungs work overtime to make up for it, leading to breathlessness during even mild exertion. Sign number 2, needing extra pillows to sleep. Orthopnea. You've gone from sleeping flat to stacking pillows, or even moving to a recliner just to breathe comfortably. That's a red flag. This gradual shift, often dismissed as comfort preference, can be an early warning of fluid backup in the lungs due to a weak heart. Sign number 3, waking up gasping for air. Paroxysmal nocturnal dyspnea. Imagine suddenly waking up in the night, gasping, panicked, and needing to sit up for relief. This terrifying event happens because fluid redistributes to your lungs when you're lying down, overwhelming your heart's ability to cope. If this happens more than once, don't ignore it. It's a sign to seek immediate medical evaluation. Sign number 4, persistent fatigue and loss of stamina. This isn't normal tiredness. It's a heavy, unrelenting fatigue that makes even basic tasks draining. Over time, many adapt without realizing it, avoiding stairs, skipping walks, blaming getting older. But true heart-related fatigue worsens gradually, and it doesn't improve with rest. Sign number 5, swelling in ankles, feet, or legs. Edema. When the heart can't keep up, blood and fluid pool in the lower body. Swelling that gets worse by evening, socks leaving deep marks, or shoes feeling tighter are all signals your body is holding onto fluid. Pressing on the swollen area may even leave a lasting indentation. Sign number 6, sudden weight gain from fluid. If your scale jumps to 3 pounds in a single day, or more than 5 pounds in a week, that's not just water weight. It often means your body is retaining fluid because your heart is failing to regulate circulation. This measurable sign often appears before more obvious symptoms. Sign number 7, frequent nighttime urination. Nocturia. Waking up multiple times at night to urinate may not just be age-related. When you lie down, excess fluid shifts back into circulation, forcing your kidneys to work harder, leading to frequent nighttime trips to the bathroom. Sign number 8, nighttime cough or wheezing. A dry, nagging cough that gets worse at night, especially when lying down, can signal fluid buildup in the lungs. Unlike a cold or allergies, this cough may bring up pink, frothy mucus and usually improves when you sit upright. Sign number 9, palpitations or irregular heartbeat. If you feel your heart fluttering, racing, or skipping beats, it may mean your heart muscle is struggling. These irregular rhythms, especially atrial fibrillation, are both a cause and a consequence of heart failure, and they can quickly worsen if untreated. Sign number 10, dizziness or near fainting. Feeling lightheaded, weak, or nearly passing out is more than dehydration. It can happen when the heart isn't pumping enough blood to supply your brain. Some patients describe sudden blackouts or near collapse moments, serious warnings that require prompt medical attention. Sign number 11, chest pressure or discomfort. While classic chest pain is often associated with heart attacks and heart failure, the discomfort may be subtle, described as tightness, heaviness, or pressure. It may worsen with activity and ease with rest. If you notice this, don't dismiss it. Chest symptoms always warrant immediate evaluation. Sign number 12, loss of appetite or feeling full quickly. When fluid builds up in the abdomen, It can cause bloating, nausea, or a feeling of fullness after just a few bites. Many dismiss this as digestive trouble, but in the context of other symptoms, it may indicate your heart isn't circulating blood properly. Sign number 1, 3. Swelling in the abdomen or sudden bloating. Fluid doesn't just collect in the legs, it can also build up in the belly, causing abdominal swelling and discomfort. This may be mistaken for weight gain or digestive issues, but it's another classic red flag that your heart isn't keeping up. Heart failure doesn't usually strike overnight. Instead, it develops gradually and your body sends out warning signs along the way. The tragedy is that too many people dismiss them until it's too late. Now that you know these 13 early signs, you can protect yourself or someone you love by recognizing the red flags early. If you notice any combination of these symptoms, don't wait. Talk to your doctor, get checked, and take control of your heart health.